Minors may consent to some selected therapies without informing parents of treatment, and court orders may be needed for minors if parents refuse to consent to needed treatments. So that can also include blood transfusions if you're Jehovah's Witness. So the right to refusal. The right of consent involves the right of refusal. The right of refusal is based on common law rights of freedom from bodily invasion or the constitutional rights of privacy and religious freedom. So the fact that we don't mandate vaccinations, because one is that there are some risks with vaccinations. I mean, people can have pretty severe reactions. Now, I'm a big proponent of vaccinations, and I always believe that the benefit outweighs the risk. But, and then also there's religious practice and constitutional rights of privacy. The same goes with blood transfusions with Jehovah's Witnesses. Now, I know there are several cases where that does get overridden in pediatric settings. The right to refusal. So consequences to the right of refusal. Refusal may mean a physical deterioration or hastening of death. Third-party reimbursement may be denied. So this is a really good example. Okay, so my son is 5, and one day he just started freaking out and saying he was having the most terrible abdominal pain. And of course, you know how little kids are. It's so hard to get answers out of them. He didn't have a fever, but he was definitely having some diarrhea, and we were thinking appendicitis. And he was screaming. So we took him to the hospital. We went through the triage, and he definitely seemed really upset still and in pain. They couldn't get vitals on him because he was just like so uncomfortable, blah, blah. So, of course, they put him in the system in the ED, and we get into a room, and then all of a sudden he feels better. And it wasn't like one of those things where he feels better. I think he perfed his abdomen or perfed his appendix. It's like he feels better, and clearly it was like gas. And my husband's like, let's just go. This is stupid. Now we're going to wait for hours, and we know nothing's wrong. And I said, if we leave now, it will be against medical advice, and we will not get this visit reimbursed by insurance. And they already checked us in and gave us the room, and the nurse already did an initial assessment. That means we already just, got a $6,000 bill without the doctor even coming in yet. So no, we're not walking out AMA. We're going to stay and see this through to the end. Which you did, and of course it was gas, and that was the story of our life. A patient may be refused the right of refusal by the state to prevent a crime or to protect the welfare of society as a whole. So if like a patient has type TB, and they refuse treatment, we can force treatment on them because it will protect welfare of society as a whole, because TB is really contagious. Let's see. Law enforcement and consent. Law enforcement may request procedures to be conducted by medical personnel on suspects. Suspects often refuse. Suspect must be under formal arrest, and there must be a likelihood that procedure will produce evidence for criminal prosecution. So if somebody is hiding cocaine in their rectum and you need a rectal performed in order to extract a foreign object or to get an x-ray or blah, blah, all the criteria has to fall under this before a provider can override somebody in custody's consent. Delay in drawing blood would lead, you have to prove that delay in drawing blood would lead to destruction of evidence. The test is reasonable and not medically contraindicated. So, I mean, if they ask for some sort of, CT with contrast in persons in renal failure, it's not reasonable. The test is performed in a reasonable manner, and state law may supersede the law enforcer's request. So whenever medical research is conducted, the investigator must disclose the research to the subject and obtain informed consent. Guidelines for informed consent in human experimentation. Federal guidelines for valid informed consent are risks to subjects must be minimized. Risks to subjects must be reasonable to relation to anticipated benefit to subject, as well as the importance of the knowledge of the expected result. So what that means is that, if the risk that you're going to put someone under in undergoing this human experimentation, not only should it be minimized, but also it has to be reasonable relative to what benefit you expect. So if you're going to put someone under a new chemo and but the expected benefit is only going to improve prognosis by a week, but the risk of this chemo is so much greater, then that does not fall under this criteria. Selections of the subjects must be equitable, meaning equal, meaning fair. Consent is sought from each prospective subject. Consent's appropriately documented. The research makes adequate provision for monitoring the data to ensure the safety of the subjects. So, if there's any risk to someone's liver, you're going to check LFTs. If there's any risk to someone's heart rhythm, you're going to check regular EKGs. Where appropriate, there are adequate provisions to protect privacy. Basic elements of information that must be included to meet federal standards of informed consent. Statement that study involves research. Description of any foreseeable risk or discomfort. Description of any benefit to the subject or others. Description of how confidentiality is going to be maintained. So are you going to be numbered? Where is the file going to be kept? Explanation about compensation. An explanation of any medical treatments are available if injury occurs, and if so, what they consist of. So, if somebody's undergoing a new drug for rheumatoid arthritis, and if there's a potential risk of fracture, that the medical treatment is going to be provided for that fracture. And what kind of medical treatment is that, right? Are you also going to pay for my physical therapy and surgery, or are you only going to pay for my brace? It also includes explanation of whom to contact for answers to pertinent questions about the research and research subjects' rights. Statement that participation was voluntary. Refusal to participate involves no penalty or loss of benefit. So meaning, if you don't do it, that doesn't mean your doctor will stop taking care of you, or you won't, keep your insurance. Statement that treatment and procedures may involve unforeseeable risk. Anticipated circumstances under which the subject's participation may be terminated by the investigator without regard to the subject's consent. Additional costs to the subject that may result from participation in the research. So, if somebody's going to end up being, dairy intolerant, and they're going to have to pay extra money to buy almond milk, that type of reasonable anticipation is needed. You also have to list consequences of the subject's decision to withdraw from the research and procedures for orderly termination of participation by the subject. Statement that any significant new findings developed during the course of the research that may relate to the subject's willingness to continue participation will be provided. So, for example, if during the research they find that the patient has less time to live, that patient needs to be notified, because they might not want to continue with this trial anymore, because the pain of it all is not going to be worth it for the time that they have left. They'd rather enjoy that what quality they have left of their life for whatever time they have. The approximate number of subjects involved. So privacy rule addresses safeguards for research, de-identified information for all these demographics like gender, age, zip code. Researchers can submit a waiver to forego authorization requirements if they wish to study a discharged patient's medical case. So that's a retrospective research. So looking at post, like someone who's been discharged case. And concerns with protecting children as research subjects have led to federal guidelines. They're underprotected. And the same with pregnant women, people in jail. Proposals involving new investigational drugs or devices have to meet the FDA regulation. One thing I want to add about consent with research is that one of the things is that informing the patient that no matter what, after they've started, they can always leave the study, always, without consequence. And that's really important that they understand that and that it's listed somewhere. Just because you don't want someone who gets into, some sort of experimentation and they respond really poorly to a drug to feel that they have to stay. And it wouldn't be fair to make them stay either.